Before I actually contracted the condition, I hadn't even heard of it. I, like most people, thought it was some form of Alzheimer's. And I think it's important that people are aware that DLB is not the same as Alzheimer's. And people like myself who have it should be treated in a different way.
Dementia with Lewy bodies is underdiagnosed and under-recognised. The work which we've been doing at Newcastle University has been about establishing diagnostic criteria for this condition. This is vitally important because it means we can diagnose the condition earlier and more accurately. This will mean that people living with this condition can have the right treatments and management that is appropriate for them. And that means better quality of life for them and their family members.
I think postmortem brain tissue is one of the most important parts of our research at Newcastle University. It allows us to see genuine tissue of people who are affected by DLB to try and understand what goes wrong, what changes in these brains, and how that could create the symptoms that are experienced by patients.
Well, the fact that Newcastle is local, and it means that I benefit certainly from the new medicines which I'm constantly being asked to try out. It's a great help to me, great comfort to me as well.
Without Newcastle University, I think Nigel would have either required daycare or, dread to think, even residential care, because I couldn't really have coped if he hadn't had the medication, which has enabled him to function reasonably well. So a lifeline, absolutely transformation.
So something I'm looking forward to in the future with my research group is that I'll be partnered with a patient with DLB. So this will give me the opportunity to both explain my research to them and understand what it's like living with DLB day to day.
I think our multidisciplinary approach at Newcastle offers the best chance of improving the lives of people affected by DLB. We have everything from clinical studies, understanding the symptoms, through to care-based studies where we try to improve the lives of people affected by DLB, through to scientific studies where we try to understand the causes of the disease to develop new treatments that will change the future for people affected by DLB.
I would say that having contact with Newcastle University has transformed my life. If it hadn't been for Newcastle University, I think my quality of life would have been a lot poorer, and I wouldn't have been able to do the things that I want to do.